What if I told you there was a drug that could radically reduce your risk of cancer? What if I also told you that it is already in your medicine cabinet? Recent studies done by an Oxford University team have shown that by taking low dosages of aspirin over 5 years reduces your risk of death from cancer by 37%. Many of you probably have a bottle of aspirin at home, but many of you probably are unaware of its full potential. As research continues, aspirin is proving to be far more than just a pain reliever. This versatile drug is worth knowing more about. This afternoon, you will hear the historical development of aspirin, how it affects the body, and about a few of the new studies linking its usage to the prevention of many life-threatening diseases. The history of aspirin is extensive, dating as far back as 3000 BC. Salicylin, the natural form of aspirin, was first documented being used medicinally by the ancient Egyptians, who used the bark of the willow trees to lower fevers as well as alleviate pain, according to Monash University's website, esprit.com. The compound was next recognized being used in 400 BC in the historical records of a Greek physician, Hippocrates, described by Mary Bellis at inventors.com. In his records, he describes a treatment for pain relief utilizing the bark and leaves of the willow tree. He prescribed chewing on the bark of the willow tree to reduce fever and relieve pain. As described by Sarah Coster Perry in her article, The History of Aspirin, in 1853, Charles Frederick Gerhardt, a French chemist, was the first to discover the compound now known as aspirin. Charles Gerhardt never marketed his findings, leaving his discoveries unknown. She further explained, in 1897, after rediscovering Gerhardt's formula, Felix Hoffmann, a German chemist, became interested in the drug. He tested the formula on his father, suffering from a medical condition, arthritis. When the compound displayed successful results in treating his father's pain, he promoted the drug to Bayer. Clinical trials began shortly after his breakthrough, and on March 6, 1899, aspirin officially became a registered trademark of Bayer Pharmaceutical Company, making aspirin one of the first non-steroidal anti-inflammatory drugs to ever have been created. Since aspirin has been on the market, continuous research has gone into understanding how it affects our bodies. According to drugs.com, aspirin is most commonly used to treat mild to moderate pain and also to reduce fever or inflammation. But how does this particular compound really produce these effects? According to Monash University at esprit.com, the drug has two main effects in the body. The first being an antiprostaglandin, or pain and fever reducing agent, the second being an antiplatelet agent, or a blood thinner. These effects can be attributed to aspirin's ability to inhibit an enzyme called cyclooxygenase, better known as COX. COX is the enzyme your body creates when it's injured. Inflammation, blood, clotting, and pain occurs when the enzyme is released as part of the healing process. Since aspirin inhibits the enzyme, it reduces fever and alleviates the pain associated with tissue damage. You may also be aware of aspirin's blood thinning properties having shown effective results in reducing the risk of heart attacks and strokes. This is why aspirin is now commonly prescribed by physicians for patients at high risk of developing these diseases. According to the CDC at cdc.gov, heart disease is the leading cause of death in the United States, taking just under 600,000 lives each year. Coronary thrombosis, or a heart attack, is defined by netdoctor.com as a blood clot in one of the 3 coronary arteries. Doctors believe the antiplatelet effects of aspirin can prevent the blood clot from becoming larger, reducing the risk of death during a heart attack. Expert Dr. Michael Vance, president of the American Board of Emergency Medicine, recommends that people who think they are having a heart attack should call 911 and then take an aspirin. The American Heart Association estimates as many as 10,000 American lives could be saved each year if people who thought they were having a heart attack would take an aspirin at the start of chest pains. More recently, there have been extraordinary discoveries suggesting aspirin's ability to prevent additional life-threatening diseases. The findings from various studies have been organized in cardiologist Keith Stouter's book, An Aspirin a Day, the wonder drug that could save your life. The first being a study done by a research group from Oxford University. Their extensive research found that by taking a low dose of aspirin daily for 5 years, you reduce your risk of dying from cancer by 37%. A study done by the Mayo Clinic found that taking aspirin just 1 time each month, your risk of developing heart disease decreases by 35%. A 20-year study done by the National Institute of Health found that those taking aspirin regularly cut their risk of developing colon cancer in half. Another study found that the usage of aspirin reduces the risk of developing lung cancer in smokers by more than 33% and throat cancers by 43%. These preliminary studies have been monumental breakthroughs in preventative medicine, and new findings are being continuously discovered. We continue to learn more about the drug and hope that one day we will be aware of its full potential. Aspirin has been around for centuries, and new usages continue to arise. While many drugs have been replaced by new, more effective alternatives, aspirin remains. It originated to solely treat pain and inflammation based on its antiprostaglandin properties. As research has continued over time, it has proven to be far more than just a pain reliever. It treats diseases, it prevents diseases, and it saves lives.
Oh my gosh, that was close.
Encore.